So the first thing I'm going to be talking about is proper sensor placement for a molar image. The first thing you want to do is make sure that your sensor is in the midline of the patient's mouth, and then you want to put it in there as far back or as far distally as you can get it in the patient's mouth without making them uncomfortable. And then on the image, you want to be able to see the distal of the second premolar. And then the steps are relatively the same for your premolar image. You just want to make sure that you rotate it a little bit so that you are able to get the distal of the canine in your image. And then another thing that plays an important role in sensor placement and making sure you're getting it correct is the positioning of your patient. So you want to make sure that they're setting up straight and that their face is looking straight forward so that their chin isn't too low or high, affecting your sensor placement. And then the next thing I want to talk about is alignment without your XCP, and this would be the easiest way I can think of to describe doing this would be making sure that you're lining the PID up with the teeth, not trying to line it up with the sensor. So just imagine that there's beams coming out of it and them going straight to the sensor. This will help you so that you don't have it being too high or too low. Just make sure it's directly parallel with the teeth. And then the correct angulations for this would be for your molars, it would be 20 to 30 degrees on your maxilla, your upper teeth. And then for your mandibular molars, it would be -5 to 0 degrees. And then for premolars, your maxillary teeth would be 30 to 40 degrees. And then your mandibular, your lower teeth would be -10 to 15 degrees. And you would just try your best to position this at whatever degree is correct for the teeth that you were positioning it for. And then something else that also helps with keeping good and bad vertical angulations would be to imagine the patient's mouth as a triangle instead of a square, and this will just help you get the correct curvature of your patient's mouth, making sure that you're aligning it so that it is going with the teeth and not with the outside of the patient's mouth. To open the contacts, again, you want to just make sure that you're rotating your PID measly so that you're not overlapping or doing any of that. So you want to imagine that there's a string going from the PID to your in between the teeth, and also making sure that you are just positioning the PID directly at the teeth. And then the last thing I want to talk about is some tips that were given in the videos that I watched. So some of the tips that were given were to ask the patient to smile when you have this inserted in their mouth. This way, like for a premolar shot, you can see if they're biting on this bite tab, so you can make sure you're getting the distal of the canine. It should just barely be on the bite tab. And then another one would be changing the position of where you stick the bite tab onto the sensor. A lot of the videos I watched, they positioned it more distally for the molars or more mesially for the premolars, and that helped them a lot. So I would recommend those, but overall that's everything I learned, and I hope that this video explained pretty well how to position your bite wing. Thank you.